So hello everyone, I'm Jessie Bayo and today I will be tackling about Chapter 10, Negative Global Flows and Processes. It includes the dangerous imports, borderless diseases like HIV and AIDS, avian flu, um, SARS, Ebola virus, and tropical diseases in Europe. Dangerous imports refers to the importation of goods that may cause risk, health, safety, or the environment. This could include items such as counterfeit products, hazardous chemicals, or illegal substances. It could also refer to the importation of invasive species or materials that could harm our ecosystem. So dangerous imports could simply means the importation of goods that is not good for our health. That's why it's dangerous and it's not safety for ourselves and to our environment. This could be an item, a food, or a product. For example, counterfeit products or imitation of product that is cheaper but does not have a good impression to the environment and have illegal substances added to it. And one of the examples of dangerous imports are those invasive species like animals that are not from the Philippines that imported and being placed on zoo will it's not their own habitat and it's dangerous to their health and to the ecosystem. And also, like for the example, if you're a student and living on boarding houses, then one of the example of it is the yung nilulutuan nyo na yung kulay green. Tas when you cook, kapag nagluluto na kayo, merong yung plastic sa loob, yon ay disposable na or tinatapon yon galing sa ibang bansa din pinupunta sa Philippines, and then tayo naman tinatanggap tas binibenta yon ng mas mura, not knowing that it has chemicals and substances that is not good for our health and to our environment. Kaso, tayong mga Pinoy, tumatangkilik pa rin tayo kahit alam nating masama ito sa kalusugan natin. 'Di ba? Pag nilulutuan yon, meron yung plastic sa loob na natatanggal, and then possibly na pupunta yon sa pagkain natin or nakakain natin when your health is not, or parang pag hindi tinatanggap yun ng katawan mo, then it could be harmful to your health and could also be harmful to the environment. Another example of dangerous imports is illegal drug. It is called illegal because it is not good for our health. It may be beneficial for uh, for others, but not for everyone. They take in drug not for their health but for just for fun. So it is not good for our health. But why is it rampant and is entering in our country? I think one of the factors of it is the people in the government or the politicians that is, protecting those illegal drugs. And we don't know that people from the government is the drug lord. So one example also is toys. There are toys that is substandard or does not reach the standard of health or reach the standard for the environment, or that could to the standard of you know the toys that is being distributed to children. So for there is I've read it online that there's some toys that is they've been painted like they are toxics painted on toys that is not good for the children. So it's one of the factors that could also be um, kanang dapat nating pagtuunan ng pansin, that Also, there are also plants that is dangerous in our country that is not or should not be distributed towards other country, because like there are animals also that is not good being here in our country and could also not survive in our country. So it is one of the example of dangerous imports, and dapat nating pagtuunan ng pansin that it is important because it could harm our health and our environment as well. What is borderless diseases? Borderless diseases are infectious diseases that can spread easily across national borders, affecting multiple countries or even continents. These diseases often transcend geographical, political, and cultural boundaries, posing significant challenges for global health authorities and necessitating coordinated international responses. Um, examples examples includes pandemics like COVID-19, Ebola, and influenza outbreaks that is very rampant nowadays, and it is known globally, and most of it are non, or there is no specific medicine to it. Borderless diseases. It typically refers to illnesses or health issues that can easily spread across national boundaries due to globalization, international travel, and interconnectedness. We sum up to five borderless diseases: HIV/AIDS, avian flu, SARS, Ebola virus, and tropical diseases on Europe. According to Follier and Thorne 2008, human immunodeficiency virus and acquired immunodeficiency syndrome spreads in various ways like blood transfusions, but it's spread through sexual human contact as an or sexually transmitted infection. So, HIV is primarily spread through contact with certain body fluids from an infected person, including blood, semen, vaginal fluids, rectal fluids, and breast milk. Common ways of transmission include unprotected sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. Symptoms of AIDS. AIDS symptoms include rapid weight loss, recurring fever, extreme tiredness, prolonged swelling of lump glands, diarrhea lasting more than a week, sores of the mouth, anus or genitals, pneumonia, red, brown, pink or purplish blotches on under the skin, and memory loss or other neurological disorders. Treatment: antiretroviral therapy. There is no cure for HIV, but it can be controlled with ART. This involves taking a combination of HIV medicines called an HIV treatment regimen every day. ART helps reduce the viral load in the blood to undetectable levels, allowing the immune system to recover and function properly. Prevention methods include using condoms, taking pre-exposure prophylaxis for people at high risk, post-exposure prophylaxis immediately after potential exposure, avoiding sharing needles, and ensuring blood products are screened for HIV. So, I want to take this opportunity to share to everybody that HIV and AIDS is not just a disease for gays. It is a disease for everyone. Like, it does not just include the people in the LGBTQ QIA community. It includes all the people that may do intersex and blood transfusion with the victim of HIV. Severe acute respiratory syndrome, coronavirus, is thought to have originated in bats and was transmitted to humans through intermediate hosts. possibly civet cat in live animals markets. Human-to-human transmission occurred primarily through respiratory droplets produced when an infected person coughs or sneezes. The symptoms of SARS typically begins with flu-like symptoms including fever, chills, muscle aches, and cough. Some individuals may also experience respiratory symptoms such as shortness of breath and pneumonia. In severe cases, SARS can lead to respiratory failure and death. Patients with severe symptoms of SARS, such as difficulty breathing or pneumonia, often require hospitalization. In the hospital, they received supportive care including oxygen therapy and intravenous fluids to maintain hydration. According to my research, with no further investigation, COVID-19 started in December 2019 in Wuhan, China. It is because of eating butts, and I think it is from the virus coming from the butt and then eat it, then transmitted because it is in the market and it is very known. So to prevent it, prevention measures of SARS include practicing good hand hygiene, avoiding close contact with individuals displaying respiratory symptoms, wearing personal protective equipment such as masks, and implementing infection control measures in healthcare. So the vaccine that we've been injecting is not a cure. It is just a prevention to prevent us from contact or having the symptoms of COVID-19. Ebola virus disease, or EVD, commonly known as Ebola, is a severe and often fatal illness caused by Ebola virus. Transmission. Ebola virus is transmitted to humans through direct contact with the bodily fluids such as blood, saliva, urine, feces, vomit, and semen of infected animals, primarily fruit bats and non-human primates. So, when eating exotic foods, we must surely clean them internally and thoroughly, and then cook it properly so that we could not experience this virus. Symptoms include fever, severe headache, muscle pain, fatigue, sore throat, and weakness. These symptoms are followed by vomiting, diarrhea, rash, impaired kidney and liver function, and in some cases, internal and external bleeding. Treatment. Patients with Ebola receive supportive therapy including extravenous fluids and electrolytes, maintaining oxygen levels, and treating other infections if they occur. And this also don't have any cure. Preventing Ebola entails rigorous infection control, hand washing, avoiding bodily fluid contact, using protective gear, ensuring safe burials, and conducting surveillance and community education for early detection and containment. Tropical diseases in Europe. While tropical diseases are typically associated with regions closer to the equator, some can also occur in Europe, particularly in areas with suitable climates and ecological conditions. One of the tropical diseases in Europe is chikungunya. Transmission of chikungunya virus is primarily transmitted to humans through the bite of infected Aedes mosquitoes. These mosquitoes typically bite during the day, particularly early in the morning and late afternoon. So, Aedes mosquito is transported and imported into other places. It is because of tires being imported. So as we all know, also here in the Philippines, it's very rampant when there is tires and then it's raining, then there is water that's being stagnant, then it would be a home for any mosquitoes. Symptoms include sudden onset of high fever, severe joint pain, mainly in the hands, wrists, ankles, and feet, headache, muscle pain, fatigue, rash, and nausea. Pain relievers such as acetaminophen or paracetamol can help reduce fever and alleviate joint pain. Non-steroidal anti-inflammatory drugs may also be used to relieve pain and inflammation, but aspirin should be avoided due to the risk of bleeding. Preventing chikungunya primarily involves reducing exposure to mosquito bites and controlling mosquito populations. The presence of diseases without a cure underscores the interconnected nature of global health and the importance of collective action to prevent, detect, and respond to emerging health threats in an increasingly interconnected world. This topic shows the dark side of globalization as it is shrinkage the distance of each continent and the interconnectedness of nations to nations, the organizations of any places. So as it is happening, this is also happening. The diseases that is not for everyone is distributed also to any places because of globalization. So globalization has advantage and disadvantages, and this report shows some of the disadvantages of globalization. Preventing the spread of globally significant viruses and diseases without a cure requires a multifaceted approach. The robust public health measures, including vaccination programs and hygiene promotion, are essential. Early detection through surveillance systems and border control measures can help contain outbreaks. Investing in research for treatments and vaccine is crucial alongside community engagement to foster trust and promote healthy behaviors. Strengthening healthcare systems and fostering international cooperation are also key components. While there are or they may not be a cure, these preventive measures can mitigate the impact until effective treatments or vaccines are developed.